So in keeping with this month's content about concussions, we're going to talk about the third way that concussion symptoms can show up in the body after a concussion. I'm Dr. Sarah Swall of Resilience RX, and let's get started talking about concussions. So there's the three primary ways that post-concussion symptoms or concussion symptoms can show up. The first is physiological, which means you get more symptoms as your heart rate increases. The second is vestibulo-ocular. That means your brain struggles to process inner ear information about balance and eye movement. The third is a cervicogenic component, and that's just a really fancy way of saying neck-related issues or issues that stem from the neck. So we touched on this a little bit last month when we talked about neck pain and headaches, but there's nerves in your neck that synapse at the same spot that nerves from your face and head synapse. And since they both synapse or end at that same spot, when that information gets sent to the brain can't necessarily discriminate where exactly that stimulus is coming from. So sometimes it makes both locations hurt. So this means you can get a headache without any head symptoms that's truly just coming from your neck. And this is very common in post-concussive syndrome or in concussion symptoms after a concussion. Because a concussion often involves a blow to the head or a jarring of the head or just a movement of the head, the neck oftentimes is strained as well. So there typically is some sort of dysfunction going on in the neck, whether it's the joints not moving very well, the muscles getting nice and tight. There's typically something going on. And when those components get resolved, the concussion symptoms like headache, dizziness, vertigo, that stuff can lessen quite a bit because one of the drivers of those symptoms is gone. So going back to those three main ways, heart rate, balance and eye movement, and neck-related issues, each person has a variety of amounts that come from each bucket. So with my concussion, I didn't have a lot of neck-related issues, but I had a lot of balance and eye movement issues as well as heart rate issues. And that was my most recent one. The one before that was pretty much primarily balance issues and no eye issues, no heart rate issues, and no neck-related issues. So it varies based on the concussion and it varies based on the person as well as your history. So if you're someone who has a history of neck, I don't like to use the word issues, but neck problems or reoccurring discomfort, if you have a concussion, your neck-related component that's driving your symptoms may be greater than it would be if you'd never had any neck discomfort or problems in the past. So if you're experiencing concussions, post-concussive syndrome, and you're like, I'd like my symptoms to be a little bit less, it's not that I can't function, or maybe you can't function, but it might just be that you want to live a little bit more of an enjoyable life, feel free, shoot me a message. I'd love to chat.